name is Trujillo, and I'm a nurse practitioner and the director of clinical operations at MAPS. I like to run. I, a while back, did a marathon, and I would hope to do one again someday in my life. A lot of my free time is taken up right now with my children. I have a 4-year-old and a 7-year-old girl, so my free time is often going to the zoo or the American Girl doll store or things that maybe aren't my personal interest, but I love my girls so much, so I'll do whatever they want to on the weekend. When I was in nursing school, I did an independent study with one of our professors who was doing a research study on treatment of pain in cancer patients. And these were patients who were hospitalized and were having an acute onset of pain. And we went in and we taught them some techniques, some nursing techniques to help manage their pain. And so it was a great experience. When I was working as a nurse in ICU after nursing school, I dealt with, again, acute onset pain, but we also had a lot of patients in the hospital who had some chronic issues, and having to deal with both of those issues at once was really difficult. So when I graduated with my master's, I saw the advertisement for a pain management position, and it seemed like a perfect fit for me. At MAPS, I can see a patient, and if I have questions about their management of their depression or anxiety, I can either walk down the hall or go across the street or pick up the phone and talk to the psychologist who's treating the patient right away, even while the patient is still in the office. It's also really nice to see the patient when they're coming in for things other than just my clinic appointments. So I might see them in the hallway and they're on their way to a physical therapy visit. It's nice to say, hey, I see that you're following up on our treatment plan, and that's really great. I might even see them in the pool doing their exercise, and they'll wave at me and say, hey, I'm doing it, I'm in the pool. So it's nice to be able to physically see them in our space doing the things that we had talked about and following up on the treatment plan. I've worked for MAPS for 11 years, and in the past 11 years I have been married and have 2 children and had a lot go on in my life outside of my career, so it's been a really nice place to work throughout all those changes in my life. MAPS has been very flexible about time off that I would need for childcare issues, working with me to make a schedule that creates a really good balance between my family life and my work life. MAPS has also, since I have been here for a while, given me a lot of opportunities to grow professionally. I've never been bored in my position. There's always a new program or something new coming along that sparks my interest. It's been a really good fit for me.